What are your feelings about the fear that's going on? Or what are your students saying? Do you have any students that possibly are here as immigrants?
Say, the fear is very real. It's impacting us in everything that we do in our professional life, whether we work in a clinical setting or not, whether we work in academia, it's impacting our patients. I'm concerned about the next generation of nurses because that fear is real. I worry about people who are being just torn apart, families that are being torn apart because of the impact to immigration. I think about language, right? There's been a lot of emphasis on words we can and cannot say, right? And I'm of the mind that regardless of what we call it, the work is going to get done. But I understand the importance of language and how changing language that we are used to using that really emphasizes the work that we do can be very difficult. I choose to focus on the things that I can change because I feel like every day I'm going through a mixture of emotions. Some days are harder than others.
Welcome to Nurses with Voices. I'm Dr. Lindra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduce stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lindra, and today I have Dr. Selena Gillis. Dr. Selena Gillis is an internationally recognized clinician, educator, and community leader. She just is transforming the landscape of nursing education and public health. And thank you so much for coming on today. Thank you. Thank you. I can't wait to get into our conversation. Why don't you let the listeners know more of who you are and what do you do and your organization?
Absolutely. Well, first, let me say thank you so much for having me today. I'm excited to talk with you. I would say that it's both an amazing and challenging time to be a nurse. And so I'm glad that we're having these conversations and many conversations like this. I am approaching my 20th year as a nurse. And when I say it, I can't believe that it's been that long. But in the last 20 years, I have been able to do so much in working with the community, something that I'm really passionate about. I mean, I come from an area where there's a struggle to be successful. We don't necessarily have the resources that we need to go to college, to stay in college, to really have a bright future. And so for me, in the last 20 years, it's really been about giving back to the community, but really also pulling others up as I climb. So I have been a nurse for 20 years. I'm also an adult nurse practitioner. I've been an NP for the last 15 years. I'm a nurse educator. I currently just transitioned to a new university, but I've been a nurse educator for the last 15 years. As a nurse practitioner and a nurse educator, I really try to find those ways where I can have synergy with everything that I do because, we wear a lot of hats, right? We're clinicians, we're educators, we're leaders, and I try to figure out ways where I can incorporate my students into everything that I do. So really working in the community to advance health equity. And I want my students to see an example of a leader who can do that so that they can go forth and do that as well. So I'm really passionate about community health and global health. As an NP, I focused on pain management and also substance use, which you don't see a lot of people specialize in, especially people of color. And so I try to do as much as I can for vulnerable populations. That's really what I am passionate about. My organization is the Academy of Diversity Leaders in Nursing. And I shouldn't say my organization, I should say our organization. We started this organization last year, and it was just with an idea. There was a group of amazing people, some who are my mentors, who thought we need to figure out a way that we can recognize, support, and promote those individuals who really have those outstanding careers and are advancing health equity and anti-racism policies. So we all came together and we founded the Academy of Diversity Leaders in Nursing. And our mission really is to advance justice, equity, diversity, and inclusion in our communities, but more importantly, in the nursing profession. So we started this organization just a year ago, and last year had our very first induction of our fellows at the National Black Nurses Association conference. And it was really excited to bring so many great individuals who are advancing health equity together to really celebrate them. So I am currently the president of the organization. And we have collaborated with others like yourself and DMPs of Color, the National Association of Hispanic Nurses, to really figure out what can we do in this moment. We're really in a challenging time, and there's been a lot of things that happen with these executive orders, and we're trying to figure out how can we have a collective voice. So we're not just talking about it, we're being about it, and we're collaborating and working together and coming out with joint statements against the things that are happening with these executive orders, because they not only affect us as professionals, but they impact our patients, they impact our communities. So looking at the advocacy work that we can do to address these policies.
Amazing. Yes. And you're right. Is collectively, there has to be a collective approach with organizations. And I know you mentioned the National Black Nurses Association, which I'm actually a member. So I'm with the Middlesex chapter, the Middlesex Regional Black Nurses Association. And I know you guys went to the Capitol was it a couple months ago? Congresswoman Crockett was actually there. Can you share a little bit about what that experience was like?
So unfortunately, I missed NBNA Day on the Hill this year. It's my first one in about 8 years that I missed, and I was really sad about it. But you can tell just by the videos and the pictures and the articles that were written about the experience, it was monumental. And so NBNA does this every year, every first February of every year. Chapters from around the country go to Capitol Hill to meet with their legislators to talk about issues that are important to us, are important and also impacting our community. And so sometimes we have some guest speakers. And so I was a little bit sad that I missed Congresswoman Crockett, but I heard that she was phenomenal. And I really love that we are able to have that type of impact on the Hill, where they expect us to show up every February. And when they can, they join us and they address our audience. And so I know that it was a wonderful event.
Yeah, I was really sad that I couldn't go either. I missed it. And when I was talking to my chapter president, she goes, try, see if you can get in. She's like, you probably should really just come, because sometimes people don't show up. And I was like, are you sure? And I think about it now, like I should have came. So I was talking with Celia McIntosh, and she was showing pictures. And I was like, oh man, I missed it. So she sent me the date for next year, like 2026. Make sure you I was like, next year, I am definitely going. This is how our voices get heard, right? So when we talk about nurses with voices, this is how we give ourselves a voice. And so the executive orders, for me, they don't much. And I say it because it's just an executive order. However, I know there's a lot of fear that, because of everything else people have seen, right? With the removal of, with ICE coming into schools and coming into cities and churches even, it does bring a lot of fear. What would you say? What do you say about that? Like, what are your feelings about the fear that's going on? Or what are your students saying? Or do you have any students that possibly are here as immigrants?
The fear is very real. It's impacting us in everything that we do in our professional life, whether we work in a clinical setting or not, whether we work in academia, it's impacting our patients. I'm concerned about the next generation of nurses because that fear is real. I worry about people who are being just torn apart, families that are being torn apart because of the impact to immigration. I think about language, right? There's been a lot of emphasis on words we can and cannot say, right? And I'm of the mind that regardless of what we call it, the work is going to get done. But I understand the importance of language and how changing language that we are used to using that really emphasizes the work that we do can be very difficult. I choose to focus on the things that I can change because I feel like every day I'm going through a mixture of emotions. Some days are harder than others. It's hurtful when I think about what's happening to different families, what I'm thinking about what's happening to my students and what this means for patients. And so I try my best to focus on the things that I can change and doing my small part to change the world, whether that's working with different organizations to lobby on the Hill, whether that's collaborating with organizations to put out statements, to have listening sessions, places where people can just come together and talk about what they're feeling and what they're experiencing. That's sort of my way of dealing with it, but it's hard. It's really hard given everything that's happening. Some of these things are rather illegal, right? But we'll be caught up in court for months to try to figure this out and figure out how we can navigate this space. But it's really challenging when we think about how far we've come and now it feels like we're going backwards.
And that part. That's the thing. It's feeling like we're going back. And listen, I'm just going to say it. Kamala Harris warned us that all of these things would happen. She tried to warn us about Project 2025. And she, that was what she ran on. We're not going back. And unfortunately, with, the scrubbing of websites, what we're doing with the Smithsonian, what we're doing with, it's heartbreaking. It's not more, I don't know for me if it's heartbreaking or if it's more sickening, right? To really see racism in action. And I'm just going to call it what it is.
Yes.
And we're trying to hide it under the guise of DEI and make it seem like DEI is such a dirty word. And, why? Are we remembering and identifying why diversity, equity, and inclusion was even placed into legislation? Are
In
we
the first
forgetting?
place, right?
Right. So are we forgetting about the civil rights movement? We're forgetting about Martin Luther King Jr. We're forgetting about the marches on Washington. It's like we're trying to erase history. And that's the part to me that's it's just sickening, because being educated people, right? You see right through, and I don't even know if you have to be really too educated to see what the writing's on the wall, right? You identify, you recognize, and what's the saying? Like you have to call, at some point you have to call a spade and recognize what you're doing. And it's so clear that you're trying to erase history, taking certain history out of the history books in school. So to your point, it is concerning for our future nurses, for our future students. We're dismantling the Department of Education. Okay. So what are we going to replace it with? And so you take that away. What are you going to replace it with? You take health and human services away. What are you going to replace it with? Right. So we have patients who are in the hospital currently, and people are being laid off. People are losing their jobs. And you have patients who are afraid because they're not sure how they're going to get cared for. Who's in control? I say all this to say, because we can take this so many different ways, but this is why we need organizations like yours and nurses in general to come together. And that's another reason why we're forming the rally right in May, because nurses need to stand for, we have to stand up for ourselves, and we have to stand up for our communities, and we can't be afraid. I know there's some nurses in some states, you can't even say the word DEI, and you'll get death threats. What? So to me, when I hear that, it's like, okay, well, I guess that hood is off. Like, that's how I look at it. So clearly you take it off your hood, and you're basically making it seem like DEI is, it's such a bad thing. Do you really feel like it's a bad thing, or are you believing what the administration is telling you, or this is just how you always felt?
Yeah. And the misinformation is sickening. People are equating DEI with Black, and that's not what it is. And then we also have to think about, well, why did we need these policies and practices in the first place? Because if we really cared about everyone, if we really cared about inclusivity, we wouldn't need policies to reinforce that these things are important. And also, if DEI is really a part of our core, removing the language from the the website shouldn't change what we do and how we behave. And so there's so much misinformation out there. It really is sickening. I think people need to do their due diligence and really do their own research and learn what DEI is all about and why we need DEI policies in the first place. I think about us as a profession. We are the largest healthcare workforce in the world, right? Forget about just talking about the United States, in the world. And so we have to have a collective voice. We have to come together, regardless of whether or not we're Democrats or Republicans. That shouldn't matter because our priority is our patient and our healthcare system. And so we have to use our collective voice to come together. And I'm so excited to hear about the rally because this is our opportunity to make sure that our voices are heard. The healthcare system cannot run without nurses. And so we have to do whatever is possible. It's our responsibility to make sure that we are advocating not just for ourselves as a profession, but we're advocating for our communities, we are advocating for our patients, and we have to do whatever possible to make sure that we let them know we're not happy with what's happening, and we are willing to band together to do whatever we need to do to make sure that our communities are well taken care of.
Right. I was watching the hands off rally, and that's how I envision our rally. Really, they were from New York, Boston, I think it was New York, Chicago, and just several cities all across the country. And that's how we need to unite, because that's how you make it, because that rally, it reached the White House. Right. It reached in and he commented. And that's how we start to make change. We start to see that, okay, people are not just hands off of my Social Security, right? Hands off of my government job. And then you call me back and and then you put me on administrative leave. Like, what is happening here? Who was voted in office? Like, who did we vote for? Well, not we, but collectively.
Yeah.
But who was voted for? And when we talk about DEI, I like to use. I heard this, and I've shared this analogy in the past. When we talk about DEI is about getting access, right? So clearly, there wasn't room for certain individuals, right, or certain communities or minority communities to be there weren't seats at the table, so to speak, for us, right? So DEI was implemented, and it was about giving people access. And I like to use the analogy when we think of the curb, the sidewalk, right, and the lower curb of the sidewalk. And the co-founder of CAN Collective, which is a diversity leadership 50 nonprofit. And she actually was the one who shared this analogy. And I said, I love it because you sum it up beautifully. So when you look at the curve of the sidewalk and you have that slanted curve, right? And that curve was put there for people with disabilities. So people with, wheelchairs, right? The mother pushing the strollers, the grocery carts. But it helps everyone, right? It's for people with disabilities, but it ends up helping people, like I just mentioned. So it ends up helping everyone. It's the same thing with DEI. It gives different communities access to underserved communities, marginalized communities. It gives them the LGBTQ community. It gives them access to where they would not have had access in the past. And when we take that away, you're saying a lot. You're saying that we want you to earn it on your merit. Well, let's look at some facts. When we talk about how Black women being the most educated, right? And why are we the most educated? We're the most educated because we've learned and we've been programmed. And now this part is my opinion. We've been programmed to want to have the highest education so that we can sit at tables so that no one can tell us that we can't. And because we're so educated, this is why we're able to fight back and to also see what you're doing, because we deserve to be at the table. So for you to say that you have to earn it on your merit, well, we've got all the credentials.
Then some, right?
Right. So where is the merit? Where we have more than enough merit. So now, so to say that someone is a DEI hire, how dare you?
We're not filling quotas here, right? We're not doing that. DEI is not about giving certain groups an unfair advantage. It's making sure that everyone has the opportunity, that everyone has access.
Absolutely. You pioneered immersive community-based learning models for nursing education. And what inspired you to shift away from traditional approaches? How have your students and communities been impacted by your innovations?
So I think in nursing, we have a bad habit of doing things how they've always been done. And I believe in stepping outside the box. Learning doesn't only take place in a classroom, right? Learning about how to take care of patients shouldn't only take place in a hospital. In fact, we don't want our patients in the hospital. We want to prevent them from going to the hospital. So I think that the true healthcare takes place in the community. Where you can really reach people is in the community. I believe that no one is going to help us like us. Listen, I'm a Brooklyn girl, New Yorker. And so I've seen some things in my life. I think about my own family members and them accessing the healthcare system and just how our communities look different. And it's such a shame that even now your zip code determines your life expectancy. So I wanted to show my students something different, whether that's taking them to a Brooklyn community or that's taking them to a rural community in Ghana, right? How we view communities vary. And so it was important for me to make sure that students can interact with patients and meet them where they are. It's not enough just to meet them in the hospital and learn about their disease process, but how about we walk through their neighborhood? Do they have access to healthy foods? Is their neighborhood safe? What are the resources that they have available to them in their neighborhoods? I think about global work. How close is the nearest hospital? Do people have clean water? Really want my students to recognize that social determinants of health are extremely important to our patient outcomes. And the way for me to learn that and to teach that to my students is to fully immerse them in that world. And so we need to go to those communities where patients live, right? It's not enough to take care of them in the hospital and give them discharge paperwork that might be very unrealistic based on where they live or what their functional capacity might be. Immerse them in the community. I have a course that I taught in Ghana twice over the summer where we bring a group of undergraduate and graduate students into the community. We don't spend any time in the classroom. And so we're engaging in cultural experiences. We're going to different community settings. We're going to different hospitals, allowing them to really see the healthcare system at its very lowest and the most extravagant healthcare system and see how that might impact patients. And so it's really important that students have that knowledge. We live in the United States, yes, but there are people here that come from all over the world, and we can't treat everyone the same. And so we have to have that cultural humility. We have to have that cultural awareness. And I think that the best way to do that is by fully immersing yourself in the community. I think about COVID and I think about communities of color and hesitancy as it relates to vaccinations. And one of the things that we were able to do with our chapter of the National Black Nurses Association, the Greater New York City chapter, we collaborated with a FQHC and helped them to develop 4 FEMA vaccination sites. And it was very important for me, being a Brooklyn girl, right, to go into a community in Brooklyn to care for people who looked like me. Now, communities of color, there's a lot of mistrust of the healthcare system, and rightfully so. And so it was important for us to show them we look like you, we care about you, and we're here to help you. Not only that, showing students that it's important that you meet these communities where they are and help them and really be invested. And so in working at a predominantly white institution, I think it's important to have students in these community spaces where they can get to know the community, really learn about their concerns, learn how to appropriately engage with them and to treat them. And so we had over 100 nursing students from different universities work with us over a matter of 4 months in our COVID vaccination clinic. And we, with those 4 sites plus pop-ups that we did at different churches in the community, we were able to administer over 28,000 vaccinations. Now, this was an experience that for some students was very monumental because at their institution, they could not go to clinical because of COVID. So not only were we fulfilling clinical hours, but they were getting a true community experience. So they were giving vaccinations, they were educating the patients, we were able to refer them to different services based on their needs. And it was a very important experience for them. So that's what I'm all about. Let's meet people where they are. Let's go to them. Let's bring the healthcare to them. 70% of those that were vaccinated were people of color. And I know for sure that many of those students, either the students that work with me in that COVID clinic and the students that work with me in global settings, whether it's Ghana or Nigeria or Haiti, these are experiences that you never forget. These are experiences that change you when you can see how impactful you can be in a community. Even if I just help one person, that means a lot because that one person can go on to do so many different things. And so I try to instill that in my students, the importance of really working with the community and going into the community and seeing what you can do to help them.
Well, I love that. I love that you take your students to, so you it's like a mission trip is what I'm hearing. You
Yes.
take them on a mission trip. I love that. And I feel like that's such a grounding experience, right? Just culturally, like the cultural connection and even taking them in a community, right? Coming from, especially during COVID, because you're right, there is such a mistrust. And I'm interested to know, what do you think contributes to the mistrust of, and I'm just interested in knowing your perspective of the mistrust that we have, because there is like a huge mistrust, and it also, because it leads to our health equities, right? And so I'm interested in to know your perspective of why that is.
Look at it historically. You think about Tuskegee, you think about Henrietta Lacks, you think about Black women who were experimented on and performed surgeries without anesthesia. You think about the fact that when they're conducting research on drugs that can help with chronic conditions like hypertension and diabetes, how we're not included in those studies. You think about all of those things. You think about the individual experiences that we might have in going to see our provider, how we might be rushed, or they might assume that we're not adhering to their guidelines, or maybe they're not incorporating our culture into the treatment plan. You think about all of those things, especially the challenges that people have when they're just simply trying to access the healthcare system. It's really problematic, and I can certainly understand why our community continues not to trust the healthcare system. And so I always think about, okay, so what can we do about it? I know in my own circles, I'm always communicating with my family and my friends about the importance of knowing your body, knowing when something isn't right, and knowing to go and get it checked out. When you go to the hospital, come with your list of questions that you want to ask your provider. If you can, bring someone with you who can advocate for you, because sometimes accessing the healthcare system can be very scary and you may forget certain things. I think about my own parents and my other family members, and where I can, I try to go with them to their appointments. I think about my own experience in the healthcare system. You think about like someone like me who's educated, right, and has this alphabet soup, but can also still be discriminated, because when I access the healthcare system, they don't see me in all of my alphabet soup, right? They see me as a Black woman, and they automatically make assumptions about me. And so as an educator, making sure that I teach my students the importance of treating people with respect, taking time to talk to them and assist them regardless of who they are or how they identify, recognize the importance of culture and how that plays a role in their healthcare and whether or not they access the healthcare system. And so I try to do as much as I can as an educator and a healthcare provider to make sure that I'm preparing the next generation of nurses to be equity-minded nurses. And that's really what I'm passionate about.
I've been watching this, like my new favorite show. It's called The Resident. I don't know if you ever heard of it. It's a show on
Yes.
Netflix.
Yep.
It's like, I'm like in season 3 now. And I'm like, oh my gosh, no one ever told me about this show. But there was an episode, it was in season 2, and it was an episode where it talked about and it was a true story. It was inspired by a true story. And a young lady, I believe her name was Kira Johnson, and she had a baby. And I believe she had a C-section, and she had a baby. And afterwards, she developed all of this pain. The resident went to the nurse. The resident even went to the doctor who did the C-section, and she was basically ignored. And by the time they got her back to the OR, she bled out. It was just terrible. And again, it was inspired by his true story, but it just goes to show you. And one thing I left out, resident mentioned during the episode, because it would flash to her being African American, right? And it would show her chart, and he called out the surgeon in the show to say, I've seen you do more for people with less symptoms who look like you. And he was like, how dare you become offensive? But listen, when you see exactly what's going on, and you have to call it out sometimes. Even the nurse, he mentioned to the nurse, like, when's the last time you checked on it? The nurse was like, oh, well, I was just so busy. And he's looking around the unit, and he sees the unit is quiet. He sees a patient being discharged, and another nurse is like laughing with her. And he doesn't see this. I mean, listen, I know it was a show, but the point is, this happened. This really happens. And it's unfortunate, again, that this was a true event. And now her husband is left without a wife. I believe they had a baby at home already, but now the newborn baby is now have to grow up without a mother.
Right.
All because of systemic bias and systemic racism.
Right. And this is reality for a lot of women of color, regardless of their education, right? We had one story where I think the mother was like the chief resident, right? Highly educated individual, and this still happened to her. And so when we see these things, we have to call them out. We have to, because it could be one of us. It could be one of our friends, one of our family members. We have to call it out.
And even my mother, my own personal experience, my mother, she was in the hospital. Her blood pressure had she had went into like rapid AFib. They had to convert her. But she was in the hospital. Her blood pressure was up. And so the nurse's response was, well, she came in with high blood pressure. And so my response was, so then what are we doing about it? Well, the doctors know. Okay, I know. So we all know. But at what point are we going to maybe ask for an adjustment in the medications, or maybe we need to look at and see what's not working, because her blood pressure just cannot stay here for another 24 to 48 hours. So what are we doing about it, aside from us knowing about it, knowing that the doctors know? So that was at 8:00 this morning, but it's 2:00 now. Right. So have we reached out to the doctors since then? But again, it was, I'm too busy. And again, these words weren't said. The body language says a lot. The attitude, this unspoken words, a lot of time is what says a lot, right? Between the gasping, or like, we're bothering you. And my mother is one person, she's very meek, and, unlike me. And but she's very like, oh, I don't want to bother the nurses. No, because your pressure you'll be done stroked out, all because of what? But then when I'm walking down the halls, I see you catering to your other patients, whether you're taking them on walks, whether you're in the rooms, laughing with them. So that concerns me, and that bothers me, right? So it just goes to show, and that's my experience that I'm sharing. Right. But it's tons of others' experience that's worse than that. And I think the story that I shared with Kira is one of them. Like, it really genuinely happens. So it doesn't make it any better when we have an administration that's placing ridiculous executive orders, cutting health and human services, cutting DEI programs that you're not just hurting the people who you're trying to hurt when you cut these programs. So what do we do in our communities? We have to continue to do what we've been doing, right? We've done pretty well for ourselves over the decades between the movements. When we talk about the Martin Luther King, right, the civil rights movement, we've come a long, long way. And my mother rode the back of the bus. She know what it's like to drink from a different fountain. I actually told her, I said, you should do a podcast episode with me, especially now.
Yes. Absolutely.
Right? I said, you should do a podcast episode with me, especially now, so that people can hear, but especially since they're trying to erase history. They need to hear from someone who's been there, like someone who rode the back of the bus, right? So someone who knows what it's like to go to, have to go to the Black person's bathroom, because you're trying to erase all of this from our education system, from our, from the history books, from government. You're trying to erase it, but people remember. There's still people around who lived it. I can go on and on about this, so I'll stop there. But I do want to thank you. I applaud you for everything, all of the amazing work that you're doing with your community. Is there anything I didn't ask you? Anything that you want to share?
Yeah, I would say, just some words of encouragement. I know that it's hard, and I think about my parents. I think about my grandmother, who was born in the 1930s, and her parents before her. We have been through a lot of challenging times, and we always persevere. We always get through it. And so I would like to hope that we can get through this as well. We have to stick together. We have to collaborate. We have to use our collective voices and really focus on the things that we can change and use our voice to make change. We're unstoppable, right? Our history has proven it. We are unstoppable. No matter what barriers or challenges you put in our way, we can overcome them. And so I just want to leave us with some optimism and a little bit of hope that we're going to work together and we are going to get through this.
We will. Thank you so much for coming on today. I really appreciate it.
Me.
Absolutely. Thank you for dropping your words of wisdom. And how can people find you?
Sure. So you can find me on LinkedIn at Selena Gillis. I'm also on Instagram, Dr._Gillis NP. And stay connected. Stay connected with me. I would love to meet you all and chat with you all and help. I really believe in pulling others up as I climb, and it's my responsibility. So anything that I can do to help the next person, so many people have done it for me, and it's my responsibility to do it for others. So reach out to me. Don't hesitate. I would love to hear from you.
All right, guys. So until next time, make sure that you stay inspired, stay educated, and stay empowered.